After steadfastly refusing to reintroduce mask mandates, the Premier, Dominic Perrottet, today did just that. From midnight, masks will again be mandatory indoors. From Monday, venues will need to go back to the 2 square metre rule and limited check-ins will resume at shops, restaurants and cafes. Dominic Perrottet says the latest rule changes are modest and he's urging people to remain calm.
Clinics like car parks, wall-to-wall walk-ins and traffic chaos. The pandemic pendulum is in full swing and travel testing and unnecessary swabs are choking the queues.
At the moment what we're seeing is that many people across the state who are asymptomatic, who do not feel unwell, are lining up for a PCR test. This is putting enormous pressure on the system.
If you haven't got symptoms or you haven't received a message telling you that you must have a PCR test, probably you don't need to have a PCR test.
COVID testing? Yep, so you can either wait. We're going to open it back up in about 10 to 15 minutes.
In Sydney's inner west, streets were banked up for blocks. Cars were turned away within an hour of opening. Reduced Christmas hours at clinics aren't helping.
I know this is a difficult logistical exercise, but the government needs to look at extending opening hours for PCR testing right across the state, particularly over the holiday period.
COVID cases are climbing relentlessly. The state recorded 5,715 new cases. That's more than a threefold jump in the last week. Hospitalisations are growing by the dozens. 347 people are admitted. One more person has died. In the face of the increase and another 1,500 health staff furloughed, a number of measures are coming back. From midnight, masks will return in all indoor spaces except at home. From Monday, indoor venues will return to 1 person per 2 square metres and QR check-ins will again be compulsory.
We think the changes we've made today are modest and proportionate, particularly as we head through the holiday season.
Although the Premier says he and his team constantly review COVID measures, the mask mandate is certainly a departure from his push for personal responsibility. And there's some good news on Omicron. The Premier says the latest advice is that it's 5 times less severe than Delta.
The state government is also working towards a plan for free rapid antigen tests, a model the United Kingdom embraced a long time ago. Tim Swanston, ABC News, Sydney.
And Tim Swanston is still with me. Tim, give us some more details on what the latest New South Wales health data says about the Omicron variant.
Well, Juanita, while both Delta and Omicron are circulating in the community, Omicron really accounts for most of those new infections. About 80% of new infections are the Omicron variant. Now, as for the total case numbers, the lion's share really are in young people between 10 to 39 years of age, some 70%. So the state's chief health officer says effectively what's happening is young people are catching the highly transmissible Omicron variant and then spreading it within their social circles. But that silver lining really is that it does appear to be much milder. The advice that the Premier and the state's chief health officer has received is that it's about 60 to 80% less likely to land you in hospital than the Delta variant.
OK, QR codes are back at shops and restaurants, but in a, quote, limited way. What does that mean?
That hasn't really been answered just as of yet. The Chief Health Officer does say that they will be introduced in a tailored sort of way, but as to specifically where, how that'll work isn't quite clear at this stage. It does appear to be a move to bring New South Wales sort of back into line with the rest of the states and territories with their check-in systems. What is clear, though, is when to get tested, and that's effectively if you've been instructed to by New South Wales Health or you develop symptoms. That's the scenario in which you should go and get a PCR test.
Tim Swanston reporting there.